Okay, good morning everyone, and welcome to the final AGM of Dorset CCG. It's lovely to see so many people here this morning, particularly staff who have managed to find a couple of hours out of work to come to this event. And it's particularly nice to see some, I'll say old faces. They're not old, they're just well-known faces. Isn't that right, Conrad? who have found time to join us this morning. We also have some people who are listening or watching online, so I can't see you obviously, but welcome to you. So just to introduce the agenda for this morning, we have a few presentations. The first one is from Vanessa Reid. Vanessa is actually on holiday at the moment, so she's not here in person, but she has made a video to update on nursing and quality. Pam is here on behalf of Vanessa. We've then got Nikki, our Chief Finance Officer, who's giving us the financial report. And then Tim, who's going to basically give a look back over the life cycle of the CCG, and then hand over to Patricia, who obviously is taking on the mantle with the ICB. We'll then have a chance to have some Q&A, and then we will wrap up. So shall we move to the first video, Keith? Thank you.
Thank you for inviting me to present the Nursing and Quality Update for the financial year 2021 to 2022. My name is Vanessa Reid and I'm the Director of Nursing and Quality at Dorset CCG. Please accept my apologies that I'm unable to be with you in person today. I hope you find this overview informative. If there are any questions, the Deputy Director of Nursing, Pam O'Shea, will be with you today and will be able to answer your questions. As a reminder, the functions and roles that sit within Nursing and Quality Directorate involve quality assurance of NHS Trust, care homes, domiciliary care providers and primary care. We also have contracts with independent hospitals and providers, so have a role in quality assurance in these areas as well. Safeguarding within Nursing and Quality Directorate encompasses safeguarding children, safeguarding adults and children who are in care. A core pillar of the quality function is around safety and risk, and the responsibility for oversight of serious incidents that occur in any provider setting. Never events, which are events that should never happen as safety controls should prevent them occurring, and mortality reviews, which includes the reviews of people who die who have a learning disability. Personal health commissioning is a core function within the Directorate, which includes continuing healthcare for adults, continuing care for children, personal health budgets, Section 117 funding and funded nursing care. This team includes a team of nurses, social workers and therapists who conduct the assessments for eligibility within these funding streams. Also within the Directorate, we have a responsibility for infection control, which includes the oversight of different types of infection within the Dorset system, assurance of providers in terms of their infection control measures and support visits to other providers. The customer care team, which deals with inquiries and complaints. And finally, we have professional practice, which is the element of work responsible for workforce development, both within nursing and links also to the lead allied health professional and the development of faculties and councils to support those professionally registered groups of staff. The Care Quality Commission regulates health and social care and primary care providers and conduct a range of inspections with regards to quality. You can see from this chart relating to NHS trusts that the organisations are rated as good, except for Dorset Healthcare, which is rated as outstanding. It's important to note that during COVID, and because of a change in the way the CQC conduct their inspections, a number of these inspections are several years old now, and also to note that Poole Hospital and the Royal Bournemouth Hospital merged and have yet to have an inspection as a merged organisation, and therefore their rating remains as separate hospitals at present. With regards to general practice, you can see the CQC ratings for primary care have improved over the last 5 years, with no practices rated as required improvement or inadequate. All practices are rated as good or outstanding. During the last year, there were 2 practices who were rated as required improvement and were re-inspected during the pandemic and have now moved to an improved position. Inspections in primary care have now restarted following the pandemic. The CQC ratings of social care presented in this slide as percentages, with less than 1% rated as inadequate, and 88.6% of residential homes and 90.2% of nursing homes rated as good or outstanding. Moving on to infection control, this chart at the top demonstrates the rates of Clostridium difficile infection, which you can see have increased in the last year. This is mirrored by the national position. There is acknowledgement that further work is required in this area to understand this upward trajectory. The gram-negative bloodstream infections remain at expected level, with a noted overall downward trajectory over the last 2 years in all 3 infection types. The methicillin-resistant Staphylococcus aureus MRSA bloodstream infections were below the expected trajectory, with 5 cases, 4 of which occurred in the community. With regards to safeguarding, we remain a statutory partner with the local authorities and the police on the Dorset Safeguarding Children's Partnership and the Adult Safeguarding Board, which combines both of the local authorities. We have established a health system safeguarding group. This group works across the NHS providers and brings together programmes of work for coordination across the NHS, learning from serious reviews both in adults and children's safeguarding. We're in the process of developing a dashboard, working with the DICE team. This will be something that we can use on a multi-professional and multi-agency basis to provide insights and targeted support to families and areas within the county. The Quality Assurance Framework for Safeguarding has now been refreshed, and that provides an overview of all the safeguarding activity and all of the learning from the statutory reviews. There are incidents nationally and locally which have been linked to COVID, both directly and indirectly, and we remain vigilant to understand any further longer-term impacts of the pandemic. The process for learning disability mortality reviews is now well embedded within the system. This chart gives you an overview of the number of notifications that were received in year and the number that have been completed and closed. We currently have 3 waiting completion. This work also links with the child death review work. Learning from all of these reviews is shared widely across the system into the quality surveillance group and with our external partners. The number of complaints is broken down to highlight a number of these relate to outcome decisions regarding eligibility for continuing care. To summarise the progress and achievements of 2021-22, there has been a maintenance of the oversight of quality of services during the pandemic. We've had to adjust our services how we respond, which has included redeploying staff to work in frontline care and into the vaccination programme. The work of the infection control team was extended to support more rigorously the care sector and primary care networks. And the medical examiner programme, which is to provide an overview of deaths, has been extended into community settings. It was already in hospitals and it's now being extended in a phased way throughout the county. The National Patient Safety Strategy has been revised and there is continued progress with implementing this locally, including the recruitment of patient safety specialists for primary care and patient safety representatives. The Governing Body Assurance Framework linked to risk was updated during the year, which is the mechanism for assuring the board on its objectives. A governance structure was implemented for the maternity and neonatal services, ensuring oversight of perinatal quality and safety. This work will take forward the final findings of the Ockenden report. There has been a refreshed safeguarding quality assurance framework for all commissioned providers and the bringing together of providers to work in relation to safeguarding. And we have appointed a Chief Nursing Information Officer for primary care to support the digital transformation. Looking forward to areas of focus in 22-23, we'll be continuing the improvement of the NHS standards for personal health commissioning, the implementation of a pooled budget for Section 117 and exploring further integrated approaches and commissioning strategies with the local authorities. We will see strengthening of quality assurance of safeguarding practice across commissioned services and work with our partners to identify vulnerability and health inequality through population health management. We'll work collaboratively with ICS partners on the implementation of the NHS Patient Safety Incident Response Framework. We will develop and implement the risk and assurance framework for the new Integrated Care Board and are developing a clinical effectiveness database using the information from the National Institute for Clinical Excellence, CQC and other national bodies to align with our annual reporting. We will continue to strengthen the infection control Dorset network and continue to provide support and guidance to care homes and primary care networks. Our intention is to expand the Learning Disability Mortality Review Team to further support quality improvement, and we will continue to work with Parliamentary Health Service Ombudsman in developing a gold standard framework for handling complaints. Thank you for allowing me to present this summary to the Annual General Meeting.
Okay, thank you very much, Vanessa. Where is she? Is it Spain? Yeah, thank you. I'm sure she'll be thinking of us, don't you think? Yeah, I can tell. Okay, so we'll move now to Nikki to give us a finance report. If you do have any questions, we will take those at the end in the Q&A after we've heard all the presentations. So just as Nikki makes her way up, just to remind you that there are no fire drills expected today. Fire doors are at that side, those two doors there at that side of the building, and the meeting point is just to the right-hand side there, and toilet facilities are out that door, but I'm sure you're aware of that by now. Nikki.
Thank you very much. It's so lovely to see everybody. I haven't seen some of you for some time. Thank you very much for this. I'm Nikki Rowland, I'm the Chief Finance Officer, and I want to just run through some aspects of the annual report and accounts. So if I first of all take you into the areas that I'm going to cover, we'll look at the financial duties, how the money was spent, how the Dorset providers are doing in the context of the CCG, and then we'll move into some of the performance areas before finally looking at the forward look for 22-23. So in terms of the CCG financial duties, it's fair to say it was a particularly challenging year financially, working with two different financial approaches that were set nationally, with two separate planning periods. So teams have had to work incredibly hard, not only within the CCG, but across all partners in the NHS to keep the level of oversight and controls. And this has been a much more challenging situation as a result. So it's especially pleasing to be able to report that despite these challenges, we were able to deliver the position. Our mandated break-even position we delivered against our running cost target. We also met the mental health investment standard, which saw new investment of £5.4 million being made, which is also being independently audited. We've also managed to retain a rolled forward accumulated surplus of £35 million, and we've also delivered on our cash and capital targets. So I think it was a good year all round. If I move on to how the money gets spent, we receive in aggregate for 21-22 £1.66 billion, and recognising that this is how we kind of spend the money. The largest proportion, 51%, goes to the acute sector, including ambulance services, with then following, as you can see on the chart, considerably less, but we have got 300 million on primary care. We've also got 143 million on mental health and learning disabilities, and also 111 million on personal health commissioning, so quite considerable sums of money in various different sectors. So how does the providers compare in relation to this? So Dorset CCG is only one partner within the system control total. We have these 4 providers that also sit within the Dorset position. Worth saying that South West Ambulance, of course, is a regional provider, so it doesn't just sit or isn't just managed within the Dorset geography, but is nonetheless sitting within the Dorset system. The efforts of all providers should also be commended in achieving a combined 0.66 million surplus. There was considerable uncertainty throughout 21-22 for all NHS organisations, and that was as much about what funding was going to be made available to us and various additional funding streams that were passed down throughout the year, which made it particularly challenging. However, it should be noted that some of the non-recurrent funding streams have supported recurrent expenditure, and therefore that has created a challenge moving into 22-23 and beyond. The capital position was overspent, however. However, we did agree that with the region, and we borrowed essentially money from another South West system of £3 million, and then we pay that back next year, and that all relates to South West Ambulance Services. So moving on to the next area, moving into performance. So if you look at the financial position in the context of performance, it's worth noting that we did still achieve a number of the national standards, and although clearly COVID has had a significant impact on our delivery, we've had particular challenges moving one from green last year to red, and that was relating to category 1 ambulance response times, which will be on the next slide. However, we have seen an improvement in the cancer treatment commencing within 31 days, where we've met the target, but we did not in 2021. However, noting that it does not include University Hospitals Dorset in the numbers, because they are part of a national pilot for faster diagnosis. So I would just caveat it on that basis. I'd also like to draw that Dorset has experienced a worsened impact as a result of COVID in 21-22. We've had in excess of 400 people per day not meeting the reason to reside in a hospital setting, which has been experienced across the South West and other parts of the country, but has also meant that across the South West it has led to a significant increase in the number of hours lost and handover delays, reaching a peak in excess of 10,000 hours per week. So if I move into the next slide, in terms of what we haven't met, there were a number of targets that we were unable to achieve, which whilst the same standards were not achieved in 1920, the performance has further deteriorated, and we were not able to meet A&E, dementia diagnosis rates, or indeed those waiting 2 weeks for a first outpatient appointment referred urgently for suspected cancer. However, a significant programme of recovery has been initiated in Dorset. It should be known that capacity is not up to 100% at the pre-COVID levels, particularly linked to infection prevention and control requirements. However, there have also been the impact of significant staff absences in 21-22, which has made recovery particularly challenging. So if I move on to the next slide, this is the elective recovery. The slide shows you the position of the Dorset system in respect of the national planning ambitions. Overall, the performance for recovery is still in line with others in the South West. However, Dorset does have a particular challenge for 104-week waits linked to orthodontic services, which is a specialist service. So whilst it's not commissioned by the CCG, nonetheless it has a particular challenge for our Dorset providers. So I look at our position moving into 22-23, alongside the challenges for the way forward in recovering performance is equally to reflect on the system financial position for 22-23, which will no longer be on the COVID financial management arrangements, and we return to a fair shares basis, which is essentially an allocative formula for your population. We also see the cessation of the hospital discharge programme, which was put in place to support moving people out of hospital faster. So this presents a risk to the system on the consequences of this ending, on mainstream budgets and services, not just for ourselves, but also our local authority colleagues. We are required to deliver a break-even position. However, we are losing 57% of the previous COVID funding and managing recurrent costs that were covered with non-recurrent means, as well as picking up additional costs of inflation, not all of which are possible to predict at this stage, but for the CCG and the future ICB, the care market is a particular area of concern. Whilst we are expecting to have a balanced capital plan position, again this is particularly challenged, particularly as some schemes were initiated before the current capital regime. So it is not possible to exit some of these areas, so this will be challenging for us. Our draft plans did show a deficit position. However, we submitted a final plan on the 20th of June, and that has brought us to a break-even plan position. However, this does include a significant amount of non-recurrent measures, as well as challenging savings targets, including tackling the no reason to reside challenges, which has significantly impacted on our productivity and efficiency as a system. So this sets not only a particularly challenging position for 22-23, but the years beyond, in order to get back into a recurrently sustainable position. Thank you for listening. I'm going to hand over now to Tim Goodson, our Chief Officer.
Okay, thank you, Nikki. It's so good to see so many people here. We should definitely have offered sort of cake and food previously, I think, at some of the AGMs. The finance is always a good warm-up act, isn't it, to get everyone sort of into the mood for things here. I've been told to stand on this line as well. It's like the X Factor now. We've got to cross, because we're doing this sort of virtually as well. So some of this is online, so if you want to go and see some of the bits, if you can't quite see it, it's available online. We're videoing the whole thing, so we are going to sort of stream it along as well. I'd like to say we've got some surprises as well, but we haven't. So Dave Grohl and Bruce Springsteen won't be joining me from behind the stage. You've only got me, I'm afraid, but we'll see what we can do. So I've been asked to do a bit of a look back, really, across the sort of the previous sort of 9 years of the CCG. I can't possibly cover all that, obviously, in this sort of period, but the first thing I want to do really is just sort of thank everybody. To all the staff, all the GPs, all our partners, everybody who's got involved in any of the consultations, all the patient groups, because whilst this is really marking the end of the CCG today, we couldn't have done it without everybody else. So it's been very much a sort of a Team Dorset effort, so I needed to put that in just before, right at the start, really. So this is in a copy which is in the legacy document, so you may have seen some of them. So at the back table there, we've got some blue copies of the legacy document that we pulled together as CCG. So if you'd like to take a copy of that, more than welcome to. We've only got a certain selection here today, so if any members of staff want it as well, then just drop Keith a line and we can sort of get you some, because we have got a larger run of it. So this is just some of the highlights of what we've done, and I'd like to see the CCG really in sort of 4 sort of phases. And particularly the first year was very much about, the formation of the CCG, coming together. Prior to that, we had to go through an authorisation process, which was various things. We had to prove that we were ready to be sort of given the reins of what effectively is a £1.5 billion budget on behalf of the Secretary of State. So there was a huge amount of work that went into that. And it was a real sort of surprise and shock, I think, to some of our GP colleagues, because we're a membership organisation. So that is different to any of the other NHS organisations. So each of the GP practices is a member of the CCG. They form themselves into 13 localities, and each of their locality leads then sat on the sort of the governing body of the CCG, and that's how decisions were actually made right at the very beginning. And the first year was really sort of getting used to that, making that sort of work, bringing people up to speed on how we wanted to do that. And we did undertake there something that we called the Big Ask. There's a few nods already in the audience as to go and present the Big Ask. So we thought, rather than just sort of setting off on this sort of journey, we should really ask people of Dorset, what actually matters to you? what would make a difference, and really set out what is it we want to do during our sort of period. So that was the very first thing that we did, and we had thousands of responses back into that. And that really led into what I think was really the second phase, and probably the element that the CCG will probably be most remembered with. We decided to undertake a series of sort of clinical service reviews, the big one being actually just called that clinical service review. But we also did one on mental health, the acute care pathway. We did one across digital, we did one across dementia, we did one across maternity services as well. But I think the CSR itself is probably the one that people will recognise, and we certainly went on a lot longer than we thought it was going to. But it really did bring everyone together and set out effectively, this is the plan for Dorset, this is how we want to go forward. Now, before we started this, and for those of you that sort of staff members here that sort of read the blog, I did put this in the blog this week. We thought the life expectancy of the CCG would probably be about 5 years at the time. There have been several changes of Christian organisations before that, so it was, you know, what could we really do that would make a difference, and could we actually tackle some of those difficult things that we hadn't done in Dorset, and for some reason, you know, for whatever reason really, they just hadn't been sort of fulfilled, and we wanted to do that. So, you know, we set off on that sort of journey to do it. It certainly took longer to go through, and there was various challenges around that, and it was certainly engaging, shall we say, with the public and some of the responses. But we did sort of get there in the end, and we sort of pursued that, and you know, we can sort of see that now around Dorset as it's beginning to be implemented. Certainly on the sort of the acute phase of that, I'll pick up a little bit later on. But you know, there are building works everywhere. We put the money in the community services, and some of the mental health bills as well are now, you know, well underway. So I kind of see that as really sort of phase 2 of the CCG. And that led to us becoming one of the pilots for the integrated care systems. So we were a wave 1 pilot, and there was only 8 at the very start of that, which we were one. And that really came off the back of it. Nationally, I think Dorset was seen as, well, there's a system that's come together. It's already doing stuff as one. It's done a consultation. It's gone out. It's made a decision. It's got its plan. And when we were asked to put together STPs, for those of you who remember that, the Sustainability and Transformation Plans, you know, ours really was written before we even started, because we'd done all the work. You know, we weren't starting from scratch on it. We just told our story through that plan, and that's really what got picked up. And we were then asked and approached, you know, we think really you should be one of these sort of pilots for system working. And that really, I think, was probably the third phase. And that really sets the groundwork for what is going to follow on from the CCG now with the integrated care boards, and what we were doing in pilots now been set in sort of legislation, which all goes live this sort of Friday. I think the fourth phase, as I see it now, was COVID. You know, we never expected that when we sort of set out on the CCG journey, and you know, it sort of came along and really changed everything, didn't it? You know, the last 2 years has been so much focused around that. And it probably, even that falls into different phases. I think, you know, the initial response, and I remember I was actually overseas, and you know, sort of coming back in and coming back to work first day back, and it was, you know, the country needs to go into lockdown. That was the instruction, and we came in. I think that was announced in the evening. We came in with the executives, say, right, we need to effectively go into lockdown for the following week. But we felt, okay, we can do this sort of straight away. So, you know, the message went out to staff, you know, to take effectively your laptops, what you need to be. We're going to sort of work from home. And I'd like to think, you know, that the CCG didn't really drop a beat in doing that. We were very well digitally sort of enabled to do that, and people were quite used to that. So people, you know, went home. We sort of carried on, and the start of that period was very much, I would describe it a bit like Groundhog Day. You know, you come in, what's the numbers, what's the latest policy, the instructions coming down, because it was very much being sort of fed down in terms of the latest intelligence and guidance around that. Can we implement it? What are the issues with that? Feed those back up, reset the following day. And that went on for quite a long period, but gradually it sort of settled down, and gradually we started to make our way through that. And you'll probably remember some of these. You know, we had effectively, you know, the protective equipment, so we had a PPE cell set up. Then it was the testing cell, then it was sort of the vaccination cells, and you know, the CCG was pivotal in those. In fact, it was our officers that led, you know, a lot of those cells, and we tried to support, you know, as much as we could, sort of the frontline colleagues. by going through some of that sort of materials that came down and sort of interpret it and then try to assist just in sort of making it happen. I think what followed on from that was really sort of the vaccination sort of stage. So again, another task, can we get the vaccine rolled out? What's the best way of doing that? And initially that was through some of the mass vaccination centres, but that soon rolled out into primary care and didn't primary care really step up to the mark on that as well. So all of a sudden, the vast number of vaccinations went out through sort of primary care. And again, we had loads of people sort of assisting with that and a load of staff members as well. Actually, after their day's work, then going to volunteer and actually work in the vaccination centres, which was, so pleasing to effectively see that. I've got the number, I looked at the actual number on this week, but I think it's 1.8 million vaccinations have been given in Dorset, which is just a staggering number really on top of everything else to get that amount out. So really we went into the vaccination period, and I'd say the third stage of that then was really the recovery, which I think is where we find ourselves now. The vaccinations are still going on, we've just done the spring booster, but predominantly the NHS and the CCG then moved into the recovery phase. Can we get services up and going? Can we start to get back to the position pre-COVID and try to bite into what is quite a large sort of backlog? So I kind of see that really as sort of the four phases that the CCG has sort of been through and other NHS partners and members have been through us on that journey as well. Now, I'm not going to say that we got everything right during that period, and you can only really sort of look back and think, did you get more right than you got wrong, and did you give it your best shot in terms of that was your window for change? Did you make a difference? And I think we actually achieved a lot in those 9 years. Other people will have different sort of views on that, and certainly there was some controversy within that. But overall, I think we gave it a pretty good go in the 9 years that we had to try to make a difference for the people of Dorset. I wish we could have done some more things that we didn't get through. The headlines, as I said, of the CSR tended to get more acute focused, but the underlying sort of message there and what came through from the clinicians was really we wanted to do more in primary care, more in community care, and more in mental health. That was really the message, to tackle some of the variation that we saw right at the very start of that process and some of the differences in sort of life expectancy across Dorset. I wish we could have helped more of the people. There's another little fact that's come up in terms of some of the individual sort of applications for sort of specialist funding through the NHS, and these are always sort of difficult cases, and the same as some of the continuing healthcare cases. But overall, when I sort of look back on the 9 years, I think, well, we've given that a pretty good go here in Dorset. So, some of the sort of top 50 facts and figures. Now this is in the legacy document, so I'm not going to go through them all, but I will pull out just a few of the highlights from it that sort of caught my eye. Plus, we all like your facts and figures, don't we? It's quite good. So just in case you can't read that. So, some of the ones, and we have picked up on some of these already. So, all of the trusts now in Dorset and all of the GP practices are rated on the CQC as good or outstanding. I don't know if there's anywhere else in the country that can say that, and certainly as a large CCG, so when we started we were the third largest in terms of population size in the country, and we were second largest on financial allocation actually, so we sort of went up there. To be able to say that all of your sort of providers there are good or outstanding, I think it's a real achievement, and it's a testament to those providers and to everybody that sort of worked with the quality team sort of bring that forward, because that wasn't the position at the start of the CQC inspections and the start of the CCG. We had a number of requires improvement in there, and I don't think we had any outstandings right at the start. So it's really pleasing to have seen people move to that position. We created more than 80 patient participation groups around the patch, which it's just a good number. If you want to talk to the people of Dorset, you can't just do it from one place. So the fact we got so many up and going really allowed that sort of two-way communications. Nikki sort of presented there. She was probably a bit too modest there, but including effectively this little 3-month period we're going to have, we'll have done 10 years of hitting effectively the financial sort of target that we've been set. So that's every single year we've hit the statutory duties as a CCG, and we've been confident in doing that as well. So a decade worth of target hidden on the finance front. We've had there 9,197 in the middle there, so that's individual patient treatment requests that have come in that we've had to process through. Each one of those requires looking at, requires a response to, and actually then off the back of that, when you do go with it, the actual commissioning of the services or the drugs or whatever rolls off the back. So there's 1,000 of those going through every year, and we've got a small team doing that. We've got Tim Robot there, which was, that's our automation process, so a little robotic automation. We sort of took the leap into that sort of area, saying, look, can we get a process, and rather than person manually doing it, can we just automate it and just make that a process that people can say, look, I've got this, I don't want to keep doing it, it's a repetitive type area, can you automate it for us? So we went into robotic automation there, and we've got a series of bots that now sort of do that. I don't know if they're aware actually, but I mean, I didn't name it, this was the pure imagination of our IT team that came up with TimBot, that won the CHC award, actually, National Robotic Automation Award. There's also a Patricia bot, I don't know if you're aware. Where's Debbie? There's a Debbie bot. There's a Tony bot as well. And I think there's a Eugene bot. So some of you know who those bots are named after. I couldn't possibly say. And there's a Craig bot that oversees us all. So Craig Wakeham was one of our GPs who sadly sort of passed away during the COVID period, who was really into the sort of the automation and the IT. So they named the head robot after Craig. And they're out there now, and we're continuing to grow those. And there's a really good story there in terms of the number of hours they actually save, because we're just automating something that, to be honest, can be quite a laborious task for somebody to do as well. So real headroads into that. The other one there, delivering Wi-Fi. It sounds, really sort of obvious now, doesn't it? But, at the start of the CCG, the GP practices didn't all have Wi-Fi. So we were one of the first in the country to run out public Wi-Fi into every GP practice across Dorset. And again, we've got a number of sites. I think we're well over about 130 odd sites, I think, including our sort of branch surgeries across there. So that's actually quite a big undertaking to do that and set up in each one. So we really invested in some of the digital stuff to sort of try to transform that. Just a few more I'll pick up then. So 200 million there. That was the investment that came off the back of the first part of the CSR investment. So we started with a case being supported for, I think it was 147 million for the work around effectively the acutes. That got increased as we went through that process. So in the end, the 200 million there has been fully signed off. So that was the major emergency hospital in the east and the major planned hospital in the east. That went through the whole process. So that is there, and the works have commenced on that process. So if people say, well, what did the CCG ever do for us? Well, there's 200 million pounds came in off the back of that directly to Dorset that wouldn't have happened unless we've done that. And of course, that now is building new theatres at Poole. It's building the beach building at Bournemouth. If you've seen that, two huge cranes going up there at the moment, where the new A&E will go in, the maternity, the children's services, the critical care stuff. So that was a direct result of that. Not all good news. So 3,500 complaints that sort of came in. That's about the whole system. A lot of people write to the CCG, and we effectively investigate or work with partners to do that. But again, we've got a team going through that, working with the partners in their teams, trying to see, what are the issues here, what can we do differently, and is there learning to sort of come out of that. There's the vaccination one up there. So 1,822,504. That was the number of vaccinations on Monday that we'd actually done, and that's to 626,000 people across Dorset. So that is a huge amount, and we're pretty much at 100% for the high risk cohorts in Dorset. The cohorts 1 to 9, if you remember that seems a long time ago, doesn't it? We're pretty much 100% coverage within those areas. We also celebrated the 70th year of the NHS, and that was another learn. We should have learned from that one, didn't we? We had cake at that one as well, and that was a full house down at Weymouth. And I should just say we had some great cakes at that. I don't know if people remember that down at the Weymouth Pavilion. We clearly had some star bakers within the CCG do that, because the effort that went in to doing it, I mean, it was good enough to be on Bake Off, wasn't it? I seem to recall we should just give a nod to Vanessa Reid here, who won the CCG Executive Star Baker Award as well for her cake. which again, she got to it because we were all in lockdown, so we never got to see it. But we did the videos and sort of shared those around. So she won the award for effectively the CCG Star Baker. So just a few more then. I'll put out that one. So we've mentioned the vaccinations, so should mention there. So Vespasian House, so the finance department got turned into a vaccination centre recently. So 25,000 vaccinations came out of Vespasian House. Not done by the finance department, I should say. But, you know, there's always scope, isn't there, you know, for artists and volunteers. Although some of our staff did go back to vaccinating and went through some of the training, and suddenly we were vaccinated, but I don't think any of the finance team were doing that. You'll be pleased to know. The development of the Dorset Insight system there, the DICE. So again, this came off the back of something that we put our hands up to. And off the back of the CSR, I was saying, you know, what were the two big learning points from that, or the two biggest points of feedback? And from the public, it was very much around distance to services. Everything was about travel distance. You know, it came across time and time again. But from all the clinicians, it was all about being able to see each other's sort of records and being seeding information. So, you know, we can't integrate and come together if we can't see effectively the actual, you know, the care record, the information, the analysis. It's very difficult to be able to act on that. And that really led to the creation of the Dorset Care Record, where we said, okay, let's start to join all these up through a single portal, a single sign-on, so you can see across. So the GPs can see what's going on in the acute hospital. The acute hospital can see what's going on the GP record. Social care can look in and they can see, well, actually, this person's been in hospital. Here's the alert. So that started to pull all the IT systems together across Dorset. And really off the back of that, we said, well, actually, we've now got all this data. We can start to pull this and use it for some of the services. And we created this system, which is off the back of a national pilot, again, that we were asked to do, around population health management. So really understanding, seeing, well, what actually is going on with the population in your area, and what are the sort of the linkages between that. And that has generated a data warehouse that we've got in Dorset, which we can use to support some of the networks, like the Cancer Network. You know, what is it that's important to you? What do you need to see? Here it is. We can pull it. We can show it. And especially unique for Dorset really is we've got the drill down to a patient level on that. So if you're a clinician, you can drill down and see, well, who is this that actually is the outlier on this service? And I remember as we were going through the population health management, we were definitely on the naughty step in terms of that pilot, because we weren't going with some of the bigger systems. We wanted to develop our own one because we wanted to be able to understand how it actually worked, and we didn't want to be tied into a huge sort of cost implication where we're buying something from, you know, one of the big nationals. We wanted to be able to sort of do it ourselves and keep it in-house. And we were clear at that point as well, you know, unless you can get down to the patient record, what real use is it? All you've done is generated another set of questions because you've looked at your population, you can see there's a variance there, you can see there's an outlier there, but you don't know who it is. So you can't actually really take it forward. You're then guessing on who it is. So we spent a lot longer at the early stages to get that right and try and get it. So actually we want to be able to drill back into the actual source data here so a clinician can see that. And that, I think, has now paid absolute dividends, and that will set up Dorset really ahead of the other systems going forward, I think, for a long time. And some of the clinicians that have been really engaged with that, it was a shame that COVID sort of came along when it did, because we were beginning to roll it out and getting people into that. You know, they absolutely love that, and they look at it because they can see the people, they can pull them back in, especially some of the GPs to the practice, and they can then do something about it. And they can see some of the links as well. So some of our highest cost patients have actually some of the lowest clinical needs. And it may not be anything to do with their clinical condition. You know, you get loneliness, you know, they've lost a partner, you know, the dog has passed away. These things all have impact. And you can start to see some of the correlation here, because you can see this person shouldn't be an outlier. Why are they? And again, some of the people that are effectively got some of our highest clinical needs are some of our lowest intervention patients. And again, why is that? Oh, because they've actually got a support network that sits around them. And you can see through this, you know, these are some of the things that are actually linking that, which actually means, you know, despite, you know, really quite complex conditions, their quality of life is actually better than some of the people with lower conditions. And this information starts to come out of some of these systems, some of the conversations that the information leads you down to. So that's been a real big effort on our sort of digital team to take that forward. I mentioned this, the CSR, there's another big number down there, the 350 million. So really, off the back of having a plan in Dorset, I would say confidence sort of grew in the position that we've got. And that plan also had within it a number of community hospitals and other things. We wanted to create some community hubs. So we're one of the new hospital programmes. In fact, we've got several schemes in the new hospital programmes. So this is the Prime Minister's 40 new hospitals. At the start of that, it also had 13 in there, which was a bit of a surprise to us. But as you sort of work through some of the schemes and how they actually play out, okay, we've ended up, I think we've got 8 in the end, which includes some of the community facilities, it includes some of the mental health facilities, and more importantly, it includes effectively the new sort of A&E critical care unit for Dorset County Hospital, because we knew that the patient flows will change in Dorset. With a major emergency hospital going in Bournemouth, that changes the flow of ambulances. So right size in Dorset County, we always knew was something that was, we would have to come back and revisit, and this has picked that up. So that's going through, and 350 million in terms of it's the total for all the schemes, the mental health and the community ones, that's already been earmarked for Dorset in that process. And that really is the fact that we'd come together as a system, we've got a plan, the CCG did hit its bit, others have picked up the baton off the back of that, continued with that, and it's been supported because it all ties into that one plan. So again, if what does the CCG have done to you? You could probably add another 350 million to that. That money wouldn't have been coming into Dorset without a plan really, and a joined up sort of system that says we can do this together, we can make the finances work, we've got the patient benefit case, and there it is. We also saw there some of the organisation changes, so that the creation of University Hospitals Dorset, and again the coming together of people that I think we've got the connections there, and we've got people talking, and people came together and they'd wanted to do it. We'd already been right at the very start of the CCG through the competition panel and been blocked. Because it was now much more joined up and there's lots of lessons learned with that, that actually got approved and that went live. I've mentioned the Dorset Care record there. So that's just some of the highlights there. There are some other ones which I'm not going to go through them, but I'll flick them up. So the presentation will be online, so if you want to look at some of these, you're welcome to do so. And it picks up some of what we said, what we did. There we go. Oh no, they're going to fly in. So this was really looking at some of the things in effectively the CSR bit. So the start of it and some of our plans was around some of the prevention stuff. So it was looking at, can you actually expand some prevention rather than treating the person? Yeah, let's sort of get there early. And we've done a number of things around that, especially some of the digital ones, some of the health and well-being support services that we've actually put in. The integrated community primary care, I've mentioned some of this. So we did put in effectively £8.5 million into some of the community services in the most deprived areas. That was always the plan to do that. We wanted to put more in, but effectively that's the money that we've managed to isolate to get in to do that. I've mentioned a lot about the CSR, but the acute care pathway as well, the mental health one, that pretty much ran along at the same sort of time, and we took the decisions to the same decision-making body on that. And that was much more co-produced really with Dorset Healthcare and a number of the mental health sort of patient groups. That led to the investment, so 4 community sort of front rooms, 2 mental health retreats, the 24/7 sort of crisis line is up and going. If you go over to St Anne's now, you'll see an eating disorders unit is being built there. That's all the steel works are up for that, and there's a pretty good picture of what it's going to look like. And that's something that's been desperately needed really for sort of the Dorset system as well, because we send a lot of people out of county for that. I think I've probably covered all of the One Acute Network sort of stuff. Pathology is another one. Pathology, the One Acute Network was something that the 3 foundation trusts, as they were then, again, picked up the baton. Let's work together on this. What can we do as one? And there's at the back of Bournemouth Hospital now, so on the sort of the Wessex Field site at the back of it, again, you'll see the steel work is up now for the new pathology unit, to go up there. I think it's already had its top and out ceremony, I believe, that one. So not wanting to sort of rest on our laurels, I thought I'd share this one because this was effectively last week. This one came in, so people haven't slowed up. They've carried on going. So this is another award on the robotic automation stuff, and that's against some really big players actually. If you go on the website, the companies that are involved in this are literally global players that are doing it, and little old Dorset CCG there popped on in there with it, and we took one of them, so that was really nice as well. So if you didn't catch any of that, I think we're just going to play a little video now, which will give you a bit of a reminder of some of that. And again, this is online.
In 2013, Dorset Clinical Commissioning Group was launched with the key mission to support people in Dorset to live healthier lives. In 2014, the Clinical Services Review was undertaken, involving 600 primary, secondary and community care clinicians. In 2016, we launched the 5-year Primary Care Commissioning Strategy and Plan. Dorset became one of the first integrated care systems in 2017, meaning we were at the forefront of providing joined-up, better coordinated health and social care for people in the county. Also in 2017, the Clinical Services Review was approved. Working with Dorset Healthcare, we set out to improve mental health services. In 2018, we celebrated 70 years of the National Health Service. In 2019, all of Dorset's foundation trusts were ranked outstanding or good by the CQC. Primary care networks were created across the county. New models of care for dementia services were approved after public consultation. A £147 million investment was made in clinically led plans to transform hospital services. And the Lifeboat Quay Medical Centre was opened, a new purpose-built medical centre in Poole for up to 13,500 patients. 2020 saw the CCG play a key role in the Dorset response to the global COVID-19 pandemic. And in December of 2020, the COVID-19 vaccination rollout in Dorset got underway, with the county recording one of the highest uptake rates in the country. In 2021, all of Dorset's GP practices were ranked outstanding or good by the CQC, the independent regulator. The Think Big initiative saw the opening of the Dorset Health Village on the top floor of Beale's department store in Poole. The South Walks House Assessment Centre opened. In 2022, after huge investment, work started at the beach building, Royal Bournemouth Hospital. And building commenced on the new Eating Disorders Unit at St Anne's Hospital, Poole. After 9 busy and productive years, on the 1st of July 2022, NHS Dorset Clinical Commissioning Group will become NHS Dorset, the public name for the new NHS Dorset Integrated Care Board.
I should just press that, shouldn't I? And I could have, we could have all gone on a cup of tea earlier. So all that really remains for me to do is, sort of thank everybody again, within the CCG in doing that. And as I mentioned at the start, we were one of the first integrated care systems, the Wave 1, and really now we're now going to hand over effectively to the integrated care board. There's a good team there coming in terms of the board there. We've all sort of met them and know them, so everyone's in sort of safe hands there, and obviously all the staff will transfer as well, so I know there's a good team to support it. So I'm going to ask Patricia to come up on stage now and just say a few words about that. And she gets the official presentation of the legacy document.
Don't know you follow that really. Gosh, what a fantastic 9 years, and a lot achieved actually, and we can spend a lot of time in the NHS looking at a deficit model and focusing on all the problems and the challenges, and it's really good actually this morning to take some time to recognise some of the really positive developments in Dorset and everyone that's been involved in delivering those on behalf of and with our communities. So I really applaud you for that. I want to start really by acknowledging that fantastic work that has been done over the last 9 years, and by you as CCG colleagues, and not just in your role as commissioners, but also in leading the integrated care system this far. Because the reality is we wouldn't have the foundations to build on now from Friday if it wasn't for that fantastic work. So acknowledging that is really important. As we look to the future, I think the changes that the Health and Care Act actually bring are really exciting, and they're actually quite significant, because it brings the NHS back to its original purpose in 1948. And none of you are old enough to remember this, but I'm sure you've read that when Bevan actually established the NHS, the cross-party agreement talked about the fact that its focus after the war should have been on reducing inequalities. And if it did its job, it would not exist for very long. And we're in year 74. And that's partly because it's moved away from that core purpose. So I think this gives us an opportunity to really focus on the things that matter to communities and play our role in reducing inequalities in its widest sense, not just around health. And that doesn't mean we're not going to focus on the other things that matter to people. You know, we're not going to stop focusing on long waits, we're not going to stop focusing on access to emergency services or the right care out of hospital. But it does mean we'll be doing that through a very different lens of health inequalities, and I think that's to the benefit of everyone. The other thing I think it brings is this legal duty to partners in the NHS to collaborate. And whilst you might say we've all been collaborating anyway, why does that matter? It's because we've all been collaborating voluntarily, and the reality is if an organisation chose not to, because the leadership team changed, we wouldn't really have much of a leg to stand on. So making this a legal duty sets in the statute the expectation of ministers around us working together in the best interests of our communities. ICSs have been given 4 strategic objectives, and my argument will be access and productivity should be business as usual anyway. We shouldn't need to put those into a strategic objective around the statute. We should be doing them anyway. But the really important ones are where we get to work with partners around reducing inequality, and we really support social and economic development because we recognise the NHS is the biggest anchor institution in Europe, probably. And how do we really get the benefit out of that? And I think that gives us a chance to develop those closer relationships with local government, the voluntary sector and private sector, because the reality is health can't do that by itself. Only 20% of someone's health and well-being is about any health intervention. The rest of it is about education, it's about housing, it's about the environment that people live in. And we can contribute to that with the way we work in our estate, but we can't do it by ourselves. So that partnership is really important if we're really going to be part of a national agenda that's about levelling up for our communities. Because as you all know, despite what the media say, levelling up is not a north-south issue. It's an issue right across the country, and we have some of the most deprived rural and seaside communities that we need to put some attention into. But the most important partner in my mind is you as citizens. It's our communities. You're best placed to know what the barriers are for your families to achieve your best lives. And we need to listen to you, we need to work alongside you, we need to develop solutions to some of your challenges with you so that we're meeting your needs. And the Integrated Care Board is all part of that journey. So our meetings will be in public, everyone will have the opportunity to listen to the conversation, ask questions at the end, and I really encourage you to do that. Come along and find out what it's all about, because your voice is really important. And our first meeting is on Friday, so any of you that would like to be there, please come along, because you'll then start to see what the journey starts to look like. But I think, as I said earlier, we couldn't do any of this without the foundations that the CCG have provided. And I'm really looking forward to working with you as colleagues and citizens, other partners across the health and care system in Dorset, so that we can really make sure that Dorset is the best place to work, the best place to live, the best place to grow up, and we're helping everyone in our communities have the opportunity to thrive. So lift off on Friday. Thank you.
Okay, so thank you very much to all those who have presented. We have an opportunity now for some questions and answers. I'm aware we've got mostly staff, not many members of the public, but if there aren't any questions, we've got a very senior and experienced team in front of us. So if anyone would like to ask a question, please raise your hand, say who you are, where you're from, and fire away. Hello, Paul. Okay, so that was shorter than Tim's presentation. So I'll give you another 10 seconds to have a think. So yeah, as I heard, everyone's obviously hungry. So that can. Oh, we do have a question. Thank you.
I'm a member of the public, ex-NHS worker, now retired, and now somebody who's using the services for my own medical needs. And can you hear me? Would you mind repeating that? Should be on. Can you hear? I'm an ex-NHS worker, very proud of the NHS and all the work that's been done. I'm now retired and I live in West Dorset and, as I say, just thank you. I now use the NHS as a patient and my health needs increase, and I'm just wondering, besides the not the commissioning group, the patient participant groups, how can I make a request about a service that might be disappearing? I already use services outside of Dorset, so I travel, but I have rheumatoid arthritis, and there may come a day when I can't access where I go. So what I'm wondering is, moving forward, how can it be put into the equation that some of the services, unless we can travel and have mobility, how can we get to them, or can those services be brought into Dorset for access? Am I making sense here? Let me first say, I think you're all doing a great job, and thank you very much. And I know from working in the NHS how difficult it can be to move things forward. And also, when funding is limited, how to get that funding to bring in that service for that small pocket, maybe in West Dorset. So that's where I'm coming from. So who could I contact as a member of the public?
All right, well, thank you for your question, and let us deal with that. It's entirely appropriate as a patient, member of the public, service user, call whatever term you wish. It's a looking forward question, really, isn't it? So perhaps I'll ask Patricia, who's now smiling sweetly, as she does at me, to answer that question.
So you probably picked on the thing that is the most important in my mind to solve. I get really fed up of this idea that unless it's super specialist, where you need critical mass and services should be provided in specialist centres, actually, a lot of what the NHS provides should be available locally in the place where you live. So my response would be, you can always write to me, and from Friday, actually, all of the correspondence, including complaints, will come to me, so I can have a really good look in and decide what we should say with the teams. So you can always write to me, and then you'll get the response that you need. It may not be an immediate solution, it may be a medium to long-term solution. For some other specialist services, what we have are some of our specialist centres, clinical teams coming into Dorset, for you to be able to access those services locally, the bits that you can access locally, and then if you need more specialist surgery, you might go out to that provider wherever they are in Southampton or whatever. So it may be one of those models that we need to look at, but write to me and I will respond.
Okay, thank you. I mean, Francis, did you want to say anything about engagement? You know, what we're doing around engagement? Just as a...
Thank you, and thank you for your question. Always very, very welcomed. Yeah, just really to add to what Patricia was saying, we're having a really strong move towards emphasising the listening element of our engagement work. We saw through COVID that the benefits of listening to people and understanding behaviours, beliefs, feelings, fears, concerns, etc. is hugely beneficial to us and actually helps us to improve experience and outcomes and change. So we've got a new strategic approach to working with people in communities, and the whole emphasis is on listening, working with, understanding, and yeah, working more closely with our communities at that local level. So we're very excited about that and embracing that way of working. And thank you for your question.
Okay, so thank you. I'll just check if there are any further questions before we move on. Okay, well, thank you for that. So that concludes the formal agenda of our last AGM, in which we have covered the highs and lows of Dorset's NHS. I hope you've enjoyed the experience. Now, there really are too many people to thank, but actually at this moment there are some very special people who have been the most senior people in our organisation that we would now like to specifically thank. So I'm going to ask Ellie to come up, and what we've done is the term Commissioned Spotlight Awards.
Yes.
Let's just use that term because it does sound quite grand, doesn't it? And I'm going to ask each of the directors, followed by Tim, to come up and receive an individual Spotlight Award. And we'll start with you, Sally, shall we? And then we'll have Phil. Charles. Bit more noise for Nikki. You can tell Nikki enjoyed that. And last, but by no means least, Mr. Tim Goodson. And before you all think we missed one, we haven't missed one. She's just not here. So Vanessa will receive hers when she returns from leave. So there are some further people just for me to mention, you know, as I said, too many, but other executives, our lay members, many of whom are here this morning, and administrative staff who work tirelessly behind the scenes to make sure all these thousands of meetings that we have actually work. And I would also like to thank our partner organisations, because without them, you know, we would not have been able to achieve what we did collectively in Dorset over the past 9 years. And I think the last time we were in this room, I may be wrong, was when we had our decision-making governing body with regard to the clinical services review. And we had many events in this room. We held our first clinical working group when we started the clinical services review in this room. And then we had our decision-making governing body there. So, you know, just a significant moment to come back here, really, I think, for our last event. Can I also thank the many colleagues from primary care? You know, as Tim mentioned, we are a membership organisation, and it's required the great work of general practice in Dorset and the support of those members to enable the work that we've done. And I personally would like to thank the many GPs and other members of the primary care teams, but particularly GPs who have taken on leadership roles as locality leads, governing body members, and now many who are working as clinical directors within the primary care group or primary care networks. It's really been a great privilege to work with you all, and I wish you well wherever your futures lie. So Tim said our journey started in 2013, but really started in 2012 when we worked on our mission and our values. And our values were to be courageous, collaborative, responsible, responsive, caring and honest. And as chair, it was really important to me throughout that we were, as an organisation, we were true to those values. And it is with some pride, I believe, that we have been, and I think we can all share in celebrating that. So the CCG finishes, but the NHS goes on, and we wish Jenny and Patricia and the ICB well. We all want the people of Dorset to lead healthier lives. So again, thank you to all of you who with me have played some part in doing that. Thank you.